Welcome to the Backcountry Health Rehab video library. Today we'll be going over how to perform sciatic nerve flossing.
So let's talk about sciatic nerve flossing. This movement really doesn't feel like much from an exercise perspective, so what's the point? The sciatic nerve is the longest and thickest nerve in the body, and without getting too technical, it runs from your lower spine through the pelvis, passing behind the piriformis muscle in your butt, and down the back of your leg through the hamstrings. Sciatica is a common condition that results from rubbing or increased pressure on the sciatic nerve anywhere along its length that is often associated with pain, tingling, or numbness radiating from the low back or butt down the leg on one side of the body. Sciatic nerve flossing has been shown to improve low back pain and spinal nerve-related pain and range of motion substantially by using a repetitive motion to glide and stretch the nerve back and forth along its path, with the goal of releasing any adhesions that have developed. With this movement, you will simultaneously tension one end of the nerve while releasing tension on the other end. Start laying on your back with your affected leg propped on a chair and your foot relaxed in a neutral position. Your affected leg should be just below the point where you feel tension or have any symptoms. As you slowly lift your head off the ground, point your toe away from you. Then, as you slowly lower your head, flex your foot back towards you. Repeat this for 10 to 20 repetitions and stop for a break if you feel your neck getting tired. You can also use a seated alternative. Sit in a firm chair with your hips and knees bent at 90 degrees and start by looking down at your feet. From here, fully straighten your affected leg at the knee, and as you extend the leg, tilt your head back to look up at the ceiling. Simultaneously lower your leg and your head back to the starting position. Lastly, you can choose to perform this movement lying on your side with hips and legs stacked and the affected leg on top. Similar to the previous versions, extend the affected leg out in front of you as you simultaneously extend your head back to look towards the wall behind you. You should feel a stretch in the back of your leg. Then, return your leg and head to the starting position together. These movements should not increase your symptoms. If you are feeling pain during the movement, try lowering the angle of your leg or slightly bending your knee to reduce tension. Otherwise, reach out to us. There are additional variations of this movement and different exercises that we can use to improve sciatica in our clinic.